Hi, I'm Dr. John Neustadt, President and founder of MBI, here for another Facebook Live. And today I want to talk to you about an unrecognized danger that too often people walk around with, the risk of getting and suffering without their doctor or pharmacist ever talking to them about it, and without ever recognizing that the cause of what they're experiencing could be drug nutrient depletions. That is, there is a whole list of medications that strip your body of nutrients. And now more than ever, more Americans are taking medications. Over 50%, 55% actually, of Americans are chronically taking medications. From 1997 to 2016, the amount of prescriptions annually have gone up from 2.4 billion to 4.5 billion prescriptions. And while pharmacists and doctors frequently talk about the obvious side effects of medications, the not so obvious, but equally as dangerous side effect is that a whole lot of those medications out there deplete nutrients. And those can cause other side effects, some actually very dangerous. There are different ways that drugs deplete nutrients. They can decrease the absorption of nutrients, like the acid-blocking medications, Protonix, Prilosec, the little purple pill. Those that are now available over the counter were never approved for long-term use actually by the FDA. They were for short-term use only, but now people are taking them for years. And by changing the pH in the stomach, which is what these medications do, they decrease the ability of your body to digest and absorb nutrients. So those medications have been known to and shown to deplete people of vitamin B12, folic acid, minerals such as iron and zinc, and they've actually been shown to be involved in increasing the risk for fractures, hip fractures in people with osteoporosis. They've now been linked to dementia and cancer risk. I think that alone is argument enough for you to have the discussion with your healthcare provider and with your pharmacist about what nutrients are being depleted by those medications if you're taking them. And even better, is there a way to get off of it and do something else naturally? Some medications deplete nutrients by shifting your cravings for certain foods, such as antipsychotic medications and steroid drugs such as prednisone. They can promote metabolic insulin resistance and metabolic syndrome, and that can increase your risk for sugar. And if people are eating more calories as sugar and craving those sweet treats, they're consuming less nutrient-dense foods, which are fruits and vegetables, good healthy sources of vitamins and minerals. And that over time can cause nutrient depletions because people just aren't taking in enough into their bodies. Other medications can decrease appetite, like ADHD medications, such as Ritalin. Those stimulant type of medications deplete appetite and again can result in decreased intake, decreased consumption of nutritious foods, which over time can set you up for nutritional deficiencies. Beta blockers for heart disease. These are the drugs I like to call the all drugs, OL. The names end in OL, like propranolol, metoprolol. They're involved in regulating heart rhythms, and they're known to deplete CoQ10 and melatonin. Well, melatonin is required to help us fall asleep. It's a circadian rhythm modulator. That is, it helps us, prepares us to fall asleep and gets us, our body, feeling tired that it's ready to rest and sleep. And without that, it can induce and create insomnia. CoQ10 is involved in creating cellular energy, and it is an antioxidant in the body. Antibiotics. Antibiotics can strip the body and deplete the body of vitamin K, B-complex vitamins like vitamin B2, vitamin B6, biotin, metformin for diabetes. Blood sugar regulation, people with diabetes is known to reduce vitamin B12. Now, decreases in many of these nutrients, minerals, vitamins, vitamin B12, folic acid, for example, can cause depression. And so people are on these medications and then they start feeling depressed. They may go talk to their healthcare provider. They may go talk to their doctor and say, I'm just feeling depressed. And instead of the doctor looking at a database or even connecting the dots that, hey, is there a nutrition deficiency going on here? Because they're not aware of necessarily the nutrients that the drugs they've been taking decrease, that they'll just prescribe an antidepressant. And antidepressants sometimes can exacerbate the problem because those can decrease appetite as well in some people, when the fix may be just as simple as taking a dietary supplement. Diuretics. Diuretics are very common. They're used for high blood pressure. They increase the excretion of urine, the production and excretion of urine. But out also with the urine comes a lot of water-soluble vitamins. The B vitamins again, vitamin C, and some minerals can also be eliminated that way too. Most people probably aren't aware that the number one cause of non-traumatic liver failure in this company is a medication. An easy to get over-the-counter medication that people who are in chronic pain are taking like it's candy. And it's Tylenol. The generic is acetaminophen. Is the number one cause of non-traumatic liver failure in the United States. Why does it do that? What's the mechanism? Well, it depletes the body of a nutrient. The nutrient is glutathione. Glutathione is required by the liver to detoxify the Tylenol and many other substances, to break it down and eliminate it. And when that glutathione, which is an antioxidant, decreases, it increases the free radicals that are generated, the free radical damage, and starts this cascade of damage to the liver that can result in liver failure. Well, hopefully people can deal with their pain, and there are many great integrative ways to do that, to not take Tylenol chronically. But glutathione is available as a dietary supplement. And there are other nutrients like N-acetylcysteine that increase glutathione as well. So if none of the medications that I mentioned today are ones that you're taking, I encourage you to do a quick Google search on the medication you're taking. There are lots of databases out there, and find out what nutrients are being depleted, or have a conversation with your pharmacist. Pharmacists are some of the most underutilized healthcare resources in our entire medical system. And most of these guys and gals are incredibly well educated, and most of the time they're just sitting back behind the counter filling prescriptions. And from many conversations with them, they love when people come up and actually ask them questions that they can go look at and research. These highly educated, highly intelligent people. So utilize your local pharmacist. Ask them questions. Ask them about this issue, and let them help you so that you don't suffer the side effects that not only can create additional problems, but in some cases can be fatal. Head on over to mbihealth.com, where there are other resources out there. And if you're taking any of these medications, check out our Supreme Multivitamin. It's a nice broad spectrum multivitamin that I created for my patients that has all the most absorbable forms of minerals, high doses of the B complex vitamins, some CoQ10, vitamin C, extra vitamin D, plant antioxidants to help you maintain your health. It's a great insurance policy against nutrient depletions. Have a fantastic day, and I will see you here next week. Bye-bye.